Good afternoon to everyone, and welcome to the fourth in our masterclass series. We are so happy that you've been able to join us today. As you know, today's session is part of a series of masterclasses that feature the faculty experts of Rockefeller College. This series is part of our year-long celebration in honor of the college's 75th anniversary. Today's discussion will be led by Associate Professor Ashley Fox. Before I hand the digital mic over to Professor Fox, I just want to provide a couple of notes. You are welcome to start posting your questions for Professor Fox at any point. You can use the chat function, and if you'd like for your question to remain anonymous, you are welcome to send it directly to me, and I will relay that question when we start the Q&A phase of today's presentation. We have enabled closed captioning for anyone who needs it. The transcript can be found in the chat function or on the bottom of your screen, depending on your version of Zoom. Additionally, I did want to advise everyone that the entirety of today's discussion will be recorded and shared through the Rockefeller College YouTube channel. With these housekeeping details set out, I'd like to welcome Professor Fox. Thank you.
Great, thank you so much. Let me go ahead and share my slides here. And of course, now I can't seem to find them, even though before they were right there. Here it is, just on the wrong slide. All right, so welcome everyone, and thank you so much for coming out. So what I'm going to be talking about today is a topic that probably many of us are very sick of hearing about, actually, COVID-19. So I think, for many of us, this is, still a question of, is the pandemic ongoing? Is it over? And many of us would like for it to be over, but even that itself has continued to be a bit of a politically polarized question. So what I'll be talking about today is COVID-19 and political polarization in the US. And just as I'll be presenting some of the research that I've done on this during the course of the pandemic, and as a little bit of background, my own background is sort of at the intersections of public health and political science. My PhD is actually in public health, but it was an interdisciplinary degree with political science, and my master's is in political science. So I think in some ways, for those of us engaged in public affairs, which is probably most of us here, maybe it's not surprising that the COVID-19 pandemic and response became politicized and polarized in different ways. But I will say that from the perspective of the public health community, this was a very surprising thing that I think that public health was very, very unprepared for. And so one thing that I think, we as a college and, faculty in political science and the policy sciences can bring to fields like public health is that political perspective and an understanding of some of these dynamics, which I think is sorely needed as we move forward and think about future, not just pandemics, but emergency responses in general. So just a little bit of context here. Again, not any surprise to any of us, but obviously the response to COVID became very polarized along political lines, and not just the policy response, but actually also people's attitudes and behaviors towards COVID-19 became very polarized along partisan lines. And in fact, research even very early on in the pandemic, like in the summer of 2020, when it was still very fresh to people, very early on, partisanship actually became the most consistently predictive factor in predicting people's COVID-19 attitudes and behaviors, even more predictive than education, income, or really anything else that people had looked at. And this was actually very surprising to people at the time, because honestly, prior to COVID, there hadn't been a ton of research looking at the relationship between partisanship and various types of health behaviors. So I'm just going to read a quote from Tom Popinski's blog, sort of reacting to some of these findings, where he states that the politics of COVID-19 are partisan is perhaps not surprising given the condition of American politics, but that mass public health behavior is more consistently predicted by partisanship than anything else we measured has profound and distressing implications for public health in the coming months. So again, sort of emphasizing that, look, policy is always partisan, right? We know that as people in public affairs, but it was quite surprising just how influential partisanship has been on people's, attitudes and behaviors towards the pandemic. And so, of course, that was sort of early on in the pandemic when we were mostly talking about social distancing. And then the same dynamic kind of continued for masking as well. And then when vaccines became available, again, we saw this same dynamic that actually people's party identification is pretty much the strongest predictor of vaccine uptake, stronger than any of the other sort of common predictors that you might think of, like income or education. And there was this sort of huge polarization in the uptake of vaccines, where especially Democrats were much more likely to get vaccinated, and people identifying as Republican, and especially people who said that they were supportive of Trump, were the least likely to be getting vaccinated. So, the basic question that several of my research studies that I'll talk about was trying to answer during the pandemic was essentially, why did COVID-19 become so politicized, right? Why did it become so partisan so fast? And was this inevitable, right? Like, could this have been avoided? And I think this is a question that a lot of people want to know for future emergencies, future pandemics, and pandemic preparedness in general. Is there a way that we can reduce, this tendency from occurring? So, in general, to this question of why do diseases become politicized, prior to the pandemic, there had been research on this question of like, when do threats become sort of polarized politically versus when do they sort of engender a more general level of concern among the public. And so there was a book by Albertson and Guderian that came out in 2015 called Anxious Politics. And what they argued was that, or really found from some of their studies, was that when the public is sort of generally anxious about a potential threat, including public health threats, they're typically more likely to put their trust in experts and accept various policy interventions that are aimed at protecting the public, even things that they would normally find unacceptable, right? So basically what they argued or found from some of their studies was that when people are just generally scared about a threat, it could be a nuclear threat, right? It could be a public health emergency. It could be a natural disaster, right? People actually do trust experts. They're scared. So they're going to turn to whoever they think can give them the answers for what they should do. And it's not necessarily a partisan or political thing at that point. And in fact, that they're willing to do things, to undertake, restraints on their individual rights, for instance, if it means that they will be safe, right? Because they have this generalized level of anxiety. However, what Albertson and Guderian also found was that when threats do become partisan, so when different parties sort of start sending different partisan cues about how to respond or how much to worry about something, that then that's when this sort of polarization happens, when people start looking to their preferred party to sort of determine how much to worry about something. So what's the problem with politicization? I will argue in a second that politicization is not all bad, actually, but in terms of like, what are the problems with politicization? Obviously, it becomes hard to coordinate action when people sort of disagree over how much of a problem something is, right? Or what to do about it. So that can impede collective action, collective efficacy breaks down. It can also lead to scapegoating, which is something that, we consistently see in pandemics, that certain groups are often, the ones that are blamed for introducing the virus or, introducing a threat, for instance. And we saw the sort of epidemic of anti-Asian hate that erupted, early in COVID-19. So stigmatizing and blaming certain groups is pretty common in disease outbreaks. And we see this again with monkeypox and trying to think about messaging around, who is most at risk for monkeypox. But then I think one of the biggest concerns people have is that people start relying more on value arguments or underlying value judgments rather than factual information in trying to make their own risk assessments, right? And how that can potentially harm public health or harm whatever outcome you're trying to achieve, because people start engaging in motivated reasoning and only listening to pieces of information that reinforce what their existing viewpoints are, rather than really looking objectively at what the risk is and trying to do the right thing. So, but I will argue that, politicization is not always a bad thing. Even though I think during the pandemic, it's really been framed as intention with public health. In fact, politicization of a disease can bring attention and resources to neglected diseases and topics. So for instance, HIV was, we all know HIV. I think all of us know what HIV is as a disease, and that's not an accident, right? That's because there was concerted effort and action by concerned groups, particularly the gay rights movement and groups, contentious politics groups like ACT UP, social movements early in the HIV epidemic, that really brought elevated attention to the disease and pushed for more research and development for life-saving medications that may not have happened in the time frame that it happened if there hadn't been this concerted effort. And by contrast, diseases that are similar to HIV, like hepatitis C, spread through similar types of pathways, haven't been as politicized. They tend to be more medicalized, and as a consequence, they failed to get the same amount of attention that HIV gets. But I think also it's important to remember that, public health has always been in tension with individual rights, and for that reason, it's very common for various types of public health interventions to become politicized, because public health does often conflict with other underlying values that we have cause to care about. And in fact, public health can have very authoritarian tendencies, which is something that I think that because of the way the response has polarized during the pandemic, people have tended, at least people very much supportive of public health measures towards COVID-19, have tended to downplay a little bit. So for instance, public safety can be exploited to suppress democracy. And we see this not just in authoritarian regimes, but even in democracies that, for instance, arguments that we should cancel the elections because, of the safety risk from going out to vote. There are ways that public health can actually be in tension with individual rights in ways that are very consequential. And in fact, prior to COVID-19, there was a movement in public health called the Health and Human Rights Movement, which had really made the case that we should always use the least restrictive means possible to achieve public health goals, and that the policies that we implement should be proportional to the threat. So, the argument was, yes, there are some times when we may need to use restrictive measures, but we need to constantly evaluate, is this the least restrictive means possible to achieve our ends? So I think, a firmer grasp of how politics interacts with public health can be leveraged to improve public health responses. So I'm going to just sort of walk us through what I see as, 4 major explanations for the politicization of the pandemic response, and 4 studies that I conducted during the pandemic that kind of speak to these different explanations. And I'll try to move through them really fast so that we can have time at the end for a broader discussion. But I think one of the first explanations that people have come to is media polarization, the way that we have these very polarized media outlets. Dismiss, and how that has contributed to, the politicization of the response. Also, obviously, Trump and, sort of populist right-wing politics, not just in the US, but really internationally as well. People have argued that that has contributed to the politicization of the response. Another major explanation people point to is the spread of misinformation and disinformation, especially on social media outlets, what some people refer to as the infodemic. And then a 4th explanation would actually be the failures of public health itself, right? That the failure of this sort of evidence-based policy paradigm in public health to really adequately account for the social and behavioral and political ways that people think about risk. So first of all, on media polarization, So, I think early in the pandemic and even preceding the pandemic, there's been increasing concern about media polarization, and even that the media may be a conduit for misinformation, which contributed to the growing polarization in the COVID-19 response. So studies early in the pandemic, for instance, found that exposure, particularly to Fox News, a conservative news media outlet, was associated with non-compliance with stay-at-home orders and vulnerability to misinformation about the pandemic. So yeah, there was a lot of concern about, like, is Fox News spreading misinformation, essentially? I will just note that, I think the opposite pathway is also, also contributed to polarization, that, CNN and MSNBC and these other cable news outlets, also, with their 24-hour news cycles, were spreading a lot of fear and panic that maybe was a reasonable amount, but maybe also was a little overhyped as well. So the research question that my co-author, who was a graduate student who's now graduated, set out to answer was essentially, is consumption of conservative news media associated with lower compliance with public health measures during COVID-19? And then conversely, is higher consumption of liberal news media, particularly CNN and MSNBC, associated with higher compliance with public health measures during COVID-19? And then we also were interested in, did the frequency of viewing these outlets matter? So, like, if you are constantly watching Fox News or constantly watching CNN and MSNBC, did that affect your behaviors and how worried you were about COVID-19? So I won't dwell on the methods, but I'll just say we conducted a survey across the US, looking at from 1,200 respondents, asking them about what news media they were watching and how frequently, and then some of their behaviors and attitudes towards COVID-19. So what we found was that, first of all, in terms of how much confidence people had in public health institutions and how they were handling the virus, including national government, state government, local government, and medical scientists, we found that there was actually little to no difference between Fox News viewers and CNN viewers in their confidence in government or in medical scientists, and actually regardless of the frequency of viewing. So even if you're an avid Fox News viewer, you still had about the same amount of confidence in the government response and medical scientists as MSNBC or CNN viewers. Now, I will note that this was early in the pandemic. So this was June of 2020 that we fielded this survey. So this was before maybe it had really had a chance to become highly polarized. We also found that there was no significant difference in how worried people were about the pandemic, that actually across the frequency of viewing these different outlets, and whether you were watching Fox News or CNN or MSNBC, you had a good amount of worry or anxiety about the pandemic. And then what we did find some differences, though, in terms of people's social distancing behaviors and face coverings. But not in the way we were expecting. So what we actually found was that people who were more frequent Fox News viewers were actually equally likely to be socially distancing all or most of the time, or wearing agreeing that wearing a face covering was important as CNN or MSNBC viewers. That where there was really a difference actually was in terms of attitudes towards face coverings, and the utility of them between Fox News viewers and CNN, MSNBC news viewers who were infrequent viewers. So people who are not watching the news very much, only occasionally watching it. That in that case, there was a much higher support for wearing face coverings among CNN and MSNBC viewers compared with Fox News viewers. But so that was surprising, that the more that you're watching Fox News, actually, the more likely you are to support wearing masks and be even with people who are CNN and MSNBC viewers. But the other area where there was a big difference was in this, sort of economy versus public health. Basically, people who were daily viewers of Fox News were more likely to say that the threat to the economy was bigger than the threat posed by COVID-19, and that the government was overreacting in their response, compared with CNN and MSNBC viewers. So, what I sort of took home from this study was that, again, it wasn't so much that people were getting misinformation or disinformation from Fox News. At least, early in the pandemic, people were putting their trust in experts, regardless of their party ID. People were pretty much supportive of some of these measures to reduce risk. But where they really disagreed was over how big of a threat the economic impacts of COVID-19 might be versus the concern about the health impacts. And so what I sort of took home from this was, and honestly, this is something that I had kind of predicted and really thought was a failure of the public health messaging, was that we really needed to do more to convey that there doesn't need to be a trade-off between these two, and to be ready with economic policies in mind already that can offset some of the harms from COVID-19. So one of the findings from previous pandemics, including Ebola, is that often there are more deaths from not just even the disease itself, but from sort of societal collapse that happens when you are not prepared. So the economic collapse, the overwhelming of hospitals. If you're not prepared, deaths from other than, things that arise other than the disease itself can often be as high or higher than deaths from the disease itself. So you really have to be prepared in that sense. But overall, what I took home from this is that early in the pandemic, there was less polarization than you might actually think. And that, I was less pessimistic about, the conservative news media outlets having, spreading mis and disinformation, and that leading to this sort of bifurcation in behavioral responses. So moving on to explanation 2, this idea that, maybe Trump or, this just sort of the populist right-wing governments were kind of politicizing or polarizing the response, sort of being in tension with evidence-based policy or with public health guidance. So just to sort of contextualize this, one thing I would say is that the response of the US was not out of line with other countries that had populist radical right leaders. So like Brazil with Bolsonaro, also sort of downplaying the extent of the pandemic, expressing a greater concern about the economy than the health impacts. Hungary, also even the UK under Boris Johnson. These countries tended to be slower to respond, tended to emphasize the economic impacts over the public health threat. But I will also note that, initially Trump had instituted certain measures, right, like a national lockdown strategy, authorizing the Defense Production Act, authorizing Operation Warp Speed to develop vaccine candidates quickly. And a lot of the initial politics was happening at the state level. Of course, that kind of quickly changed. And pretty soon the president started talking about sort of folk cures like light or bleach that were, unproven treatments and treatments that hadn't been clinically tested. And then a sort of adoption and promotion of this Great Barrington Declaration, this idea that we should go to herd immunity, which was basically throw off, any prevention measures so that we can just allow this to spread as quickly as possible. So, the question was really, how much did some of this rhetoric contribute to the polarization of the response and lead to potentially followers of Trump or more conservative members of the public being less likely to engage in health protective behaviors. So I looked at this again with one of my students, and what we wanted to do was actually test out that contention by Albertson and Guderian that, and ask the question, like, did the public initially trust scientists and public health actors? And then did that sort of diverge as time went on once the response became more politicized? And then how did, health behaviors change over time? Did they sort of become polarized in line with the way that the partisan politics was going? Or how much of this was actually driven by a declining trust in experts more so than political polarization? Because it's actually not clear what is driving this? How much of it is just people are following what their preferred political leaders are saying, or is it that there's a trust gap that's developed, that, public health leaders, because they kept giving conflicting advice or being kind of wishy-washy on things or not really giving the right messaging, did that lead to declining trust in public health actors? So again, I won't go into the details of the study, but we used some secondary data for this from the Understanding America study, which tracks thousands of Americans, about 6,000 Americans over the whole time of the pandemic. And we used that sample to do our analysis. And what we found some interesting things. So first of all, we were looking at trust in public health institutions. So trust in the Department of Health and Human Services, the CDC, and local health departments. And what we found was that early in the pandemic, most people did trust, public health institutions, but that mistrust in these institutions increased a lot over time. But in particular, so when we looked at this by party identification, we found that very early on, so like in March of 2020, Republicans, Democrats, and independents were all pretty much aligned in terms of how much they trusted public health institutions. There was very high levels of trust in public health institutions, but we see a very rapid polarization where particularly Republicans and independents, their trust in these institutions declines precipitously, and whereas Democrats stay very trusting of public health institutions throughout the pandemic. And so I know this is a little confusing, but this is actually measuring mistrust. So as this increases, this shows that mistrust is increasing. So these graphs are too overwhelming, but I'll just explain basically what we found. Basically, what we found was that at the end of the day, there were partisan differences in people's vaccine uptake, how much they were wearing masks, how much they were socially distancing and avoiding contact with people. But ultimately, what we found was that the bigger predictor was not partisanship, but was actually trust in the public health institutions. So it wasn't per se being conservative that was making people like not follow public health guidance. It was being conservative, but also lacking trust in the public health institutions. And even the same thing for Democrats, Democrats who didn't trust public health institutions were, even though on the whole they were still following guidance, they were less likely to follow guidance than those who actually did trust public health institutions. So some of our conclusions from this study were that, the public started off trusting public health authorities and initially sort of complied with social distancing, even in ways that we thought was really impossible in the US. If you recall, initially we thought, okay, well, maybe China can do these lockdown measures, but, we're never going to be able to pull that off in the US. But people actually did, because I think they were very worried. They did comply initially. But, the response became very polarized. And a lot of this was due to declining trust in experts, as people were getting conflicting messages as the pandemic continued. Okay, so explanation 3, misinformation and disinformation, right? How much is this playing into, why people didn't comply with some of these public health guidance? So I guess what I want to start off by emphasizing is that, it's particularly mentioned vaccine hesitancy here. It is not and was not inevitable that vaccine hesitancy should be higher among political conservatives, even though that's what we're seeing now. Actually, there was initial concern that, first of all, that African-American population might be the most sort of vaccine hesitant. Also, prior to COVID, a lot of the sort of vaccine hesitant groups in the US tended to be, for instance, like largely white suburban moms and even kind of liberal clusters of people who were skeptical of the pharmaceutical industry and, therefore were skeptical of vaccinations. So if anything, like vaccine hesitancy historically at certain points had been more of an almost like liberal or kind of lefty thing, or in the purview of like, white suburban moms. But there were some things that have happened over time that has really changed this dynamic. And I think the main thing to emphasize is that this was this sort of trying to influence conservatives to be vaccine hesitant is a very deliberate strategy that has been undertaken by interested actors. So for instance, there's evidence of like Russian intelligence purposely trying to spread anti-vax sentiment within certain groups. And also the anti-vax movement itself, there's some evidence that they've started targeting political conservatives because they thought that they could align their views with this idea of like medical freedom and, this idea of individual rights, which tends to appeal more to conservative values. So I just want to emphasize that it's not inevitable that this should have become politicized in this or polarized in this way. So I undertook some research with some co-authors during the pandemic. Again, this was early in the pandemic. This was July of 2020. So before vaccines were even developed or had become available. But what we were looking at was how COVID-19 vaccine conversations were unfolding on Twitter. And even in July of 2020, people were already talking about, COVID-19 vaccines, like, would we develop them? Would they be on the horizon? So we looked at, who were the most influential actors and what were the types of messages that were being conveyed. I won't go into details again about the methods, just to say we looked at like millions of tweets on COVID-19 vaccines during July of 2020. And what we found was that vaccine conversations were very highly polarized, with different actors occupying very separate clusters, and that the anti-vaccine cluster was the most densely connected group. And so, in fact, you can see here that we have like this sort of political right cluster, which is very clustered close to the anti-vax accounts and close to the Trump and White House accounts. Whereas we have this other cluster over here that has people on the political left, major news media outlets, and medical experts and academic organizations. So another finding was that among the 100 most influential actors, that medical experts were hugely outnumbered by partisan actors and activist vaccine skeptics. And scientists and medical actors were largely absent from the conservative networks. So even in July of 2020, this was already a very polarized conversation. The other thing we found that I think is worth highlighting is that there were conspiracy theories on both sides. They just have a very different nature to them. Okay, so on the political left and the political left cluster, we found much more expression of concerns about the independence of big pharma, right? Like, can we trust big pharma? Basically, why are they developing these vaccines? The profit motive, like, would the vaccines be free? Are they trying to make money? And the rushed development, because if you remember early on, there was this concern that Trump is rushing the vaccine development for political reasons, and therefore they may not be safe, right? So there was concerns about safety on the political left as well. On the political right, there was evidence of, conspiracy theories about Bill Gates, depopulation motives, some things about DNA disruption. So, I think, again, in terms of polarization, I think it's important to emphasize there are concerns on both sides. And even you could argue conspiracy theories on both sides, but they are motivated by very different underlying values. So, just to summarize the point here, vaccine hesitancy is deliberately actually being advanced in conservative networks by politically motivated actors with the explicit goal of sowing division. So this is not an accident that we're seeing this polarization, and it's not per se due to inherent underlying value conflicts, but rather these value conflicts are constructed by interested actors. So it's not inevitable that we should have ended up in this particular situation. And the last point I make, and then I'll open it up for discussion, is about, I want to sort of refocus the blame here for a second on basically public health itself, right? Because I do think that, in some ways, public health, at least by some, has been like kind of glorified as, they're the true science, and we believe in science, not fiction, right? But I think that public health also has its share of blame here in terms of particularly failures of communication during the pandemic. So I think there were a lot of communication failures, and actually, science and the public health response itself really became politicized during COVID. And some of this predated COVID. Science was already becoming politicized. So, basically kind of belief in science and not fiction has become kind of a liberal issue. And science doubting or pseudoscience has become more of a conservative issue. Again, I would go back to say that that's not inevitable that should develop that way. I think it's just the way that partisan ideas have developed. But I think some of the risks of this idea that, you can't run away from the data, or, public health shouldn't be governed by politics, is that we're assuming that, data and evidence and quote science can provide us with all of the answers to what we should do in a public health emergency. And I would argue that it's not that simple. I think that actually there are these deep conflicts that arise between collective rights and individual rights, between this kind of paternalistic attitude of we know what's best for you and, individual rights. And, the data and the science don't speak for themselves, right? We have to decide where is the line that we want to draw, what is the appropriate line, and what should we do based on the information that we have. And for that, I think we do need policymakers to make decisions. So I think a lot of this really comes down to these like long-standing factual debates and value debates that we often have in policy studies. And basically the idea that, data cannot answer all of the sort of normative questions about what we should do, right? Like, so for instance, during COVID-19, I think there's been questions about like how much risk is an acceptable amount of risk, right? Do we need to go for like zero COVID like they're doing in China? And if we do that, like at what cost, right? There's tremendous cost to society, not just economic costs, but like social costs to our mental health, costs to health in other areas of pursuing that strategy, versus allowing some degree of risk and then letting people decide, what is a comfortable level of risk for them. So, what are the acceptable trade-offs that we should tolerate? At the end of the day, I think those are really normative questions that can't really be answered with data and science alone. So one thing that I came up with, again, with a co-author was this framework for dissecting issues into the elements that are factual debates and the elements that are value debates, right? So there are some factual debates that are out there, right? Like how effective are school closures, for instance, at reducing COVID-19 transmission? How impactful will that be on COVID-19 rates? But then there's also value questions about like, should children, bear the burden of the response to COVID? And, who should bear the burden of the response, right? And that's not necessarily evident, right? That is something that we have to discuss and talk about, and is more of a normative question. Same thing with masks, right? Like there's an element of mask wearing that we can try to identify, how much will it reduce transmission? But then there's also the question about individual rights and, should we allow or tolerate, some degree of, level of risk for people versus how much does it actually reduce risk from a factual perspective? So how can this maybe help us craft better public health responses? So for me, it's really about learning how to frame our messages in more productive ways. So for instance, I think there was a huge lost opportunity in public health to have said, okay, if you wear a mask, for instance, then we can reduce social distancing measures, right? Like we don't have to have 6 feet of social distancing and close down businesses if everybody wears a mask. And we could have framed mask wearing actually as a way to regain freedom, right? Like if you want your freedom, if you want to be able to go around and go about your life more freely, then all you need to do is wear a mask. And then the same thing with vaccines. Once vaccines become available, if you want to regain your freedom and not have to wear a mask, not have to, socially distance, you can do that, but you need to get a vaccine, right? So I think we framed these as like all restrictive measures as opposed to framing it in ways that might comport more with, particularly with more conservative or individualistic type values. So I'm going to leave off there. I think we still have 20 minutes for discussion. That actually worked out very well. And I hope people have questions, thoughts, disagreements with what I've said. It's fine too. And I will stop sharing.
So Professor Fox, we do have one question in the chat from Michael Tillman. I don't know if you have access to the chat. If you can read it, it's a lengthy question, so I don't want to bore everyone with reading it aloud.
Okay. Control and agency in dangerous situations feel more dominant recently. Brexit's take back control. Could it be that politicization of the COVID-19 response, outgrowth of agency control? I don't know if Michael wants to maybe restate or elaborate, because I might get wrong what he's asking.
Hi, yeah, I'll jump in, sorry. In so much as we're looking at, and the data was incredibly helpful. My daughter is actually a public health major at Tulane, so I'm going to send her this recording. We're looking at what happened during COVID as a response to COVID. And there was a public health emergency and we're addressing what was in front of us. But wasn't the political environment trending in that direction anything, where if it wasn't COVID, it was going to be something else, like the next referendum, the next election, the next whatever expression people could have in rebellion against the sort of neoliberal world order that many felt left them behind, for all the racist and misogynistic and other biases that shape those conversations. But if it wasn't COVID, it would have been something else, like another war in the Balkans, or another referendum somewhere, or Greece, finally pulling the trigger on fighting the IMF. I mean, something. So rather than, is the cause and effect here sort of gotten swapped?
Yeah, no, I completely agree with you. I think it was really that, we were already polarized, right? And so when you're already and if anything, I think the surprising findings from some of my studies and the things that surprised me from them was just that at the very beginning, we were less polarized than I thought we were, or like that we would have been. Honestly, there was a sort of brief moment where people were like, I think collectively very anxious about COVID and willing to, sort of undertake measures that they ordinarily wouldn't in order to reduce the spread. And then, as time went on, that polarized more. I still think there were probably things we could have done to mitigate some of that, even knowing that we were already polarized, and it's also surprising at how much people did at least trust the CDC initially. And this even predates, some of the results that I showed. Like if you look at the Pew Center has these polls where they ask about like how much people trust the CDC, like 80-90% of the American public said that they trusted the CDC prior to COVID. And I mean, so I think some of our institutions actually did have very high trust. And I think some of that has actually declined now. But yes, I would tend to agree that this is part of a broader trend, and in societies that were already polarized, it just sort of tacked on to that existing polarization. But I do think that public health experts, or people working on the public health response should be aware of that and, try to adapt their communication strategies in accordance with that, in some of the ways that I was starting to talk about at the end, that, you don't, we should have known that this would be a hyper polarizing issue, and we could have gotten out in front of that. I think especially around the economic policy solutions and economic messaging of it, I think we really failed there in ways that were quite predictable, honestly, at least to people who are sort of aware of these issues.
A public health professor at Brooklyn College once said to me, people don't think about clean water when the water's clean, and they only think about it when there's a problem. So,
yep.
Thank you.
Yeah.
And I did have one question that was sent directly to me. I can read that aloud. Can you talk a little bit about how each of the 4 things you discussed are interrelated? For instance, if you support Trump, are you also more likely to be influenced by conservative media? If so, does this lead to decreased trust and increased polarization?
Yeah, I mean, I definitely think it's very difficult to separate these. And any attempt to do so may actually be fairly futile. Nevertheless, I have tried to do this in some studies, trying to understand, for instance, even this just question of, is it conservatives overall that are like, more vaccine hesitant or less likely to want to wear a mask, for instance, or is it really specifically Trump supporters, right? Is that more like a specific faction within? And then even looking at that, what is driving that, right? How much of it is this underlying distrust of, establishment institutions versus how much of it is maybe what media they're consuming or social media or, the specific targeting and algorithms that go into people's media consumption today, where it's like very easy to get to these conspiracy theories that, are going to influence people. So I do think it's almost impossible to completely dissociate it, honestly, and it is interconnected. Yeah, I wish I had a better explanation.
Oh, that's great. And I see Dean Novkov put a couple of questions in.
Yeah.
Yeah.
Yeah. So how much of this is about COVID being far more politicized than other public health concerns versus politics just being more visible because of polarization? And is there any hope for making progress through harm reduction frames? So I think on the first part, I guess one reason why I think it was inevitable that COVID-19 would become politicized was just that it's so visible, right? I mean, it's like it impacted every aspect of our entire lives for 3 years. So like, how could this not become? I would be very concerned if it didn't become political at some level, I think, and again, I go back to I actually think we should sometimes politicize things at least a bit, in terms of debating what is the best course of action to move forward. But one thing that really bugged me about COVID-19, I think, is just the way that, because I've studied epidemics and pandemics for a very long time, including in other parts of the world, right? Like the, Ebola outbreaks in West Africa, Zika, all of the different diseases that affect people all over the world. And, nobody cares. Nobody pays attention. Nobody's talking about let's shut down the entire global economy when it's, a pandemic that's affecting people in Africa, right? Nobody cares. It's just, it barely makes a dent in the media, and it only does if a case happens to get over here. And so that was always very dismaying to me. And for instance, I was doing some research looking at, different, how many people die from different things, right? And so lack of water and sanitation causes almost 1 million child deaths every single year all over the globe, right? So just not having adequate water and sanitation, every single year, at least 1 million children are dying from this, right? And there are things that we could do about it, but again, nobody cares because it's affecting those kids over there, not our problem, nothing we can do about it, et cetera. So it really bothers me as somebody who has studied public health in other parts of the world for a very long time that oh, now we care when it affects us, right? Or when it affects wealthy, powerful people equally to, less wealthy and more vulnerable people, right? So yeah, I think a lot of it became politicized because of who it affects, I guess. And then in terms of harm reduction frames, I would have to probe a bit more on what you're thinking in terms of harm reduction frames. But yeah, I do think that just being thoughtful about how we frame things, and not just making it even now, I think there's a lot of people talking about long COVID, right? As don't forget about COVID. What about long COVID? And I agree with that to a point, but I think the people that are saying this never specify what is it that you want us to do to prevent or reduce long COVID. What are you proposing? Are you proposing bringing back masking? Are you proposing bringing back social distancing? Because clearly there's not going to be a lot of public support for that. But, I still think there's room to, increase vaccination rates. And I think we should be doing more to do that. But yeah, I think the problem is people don't often, they'll frame a demand or they'll frame a problem long COVID is a problem. But then what's the solution? And if the solution is something unacceptable, people aren't going to buy into it, right? So you have to, I always teach this in my classes, you've got to pair the problem with the solution, right? And that's how you get the most traction. Sorry, I see there's some other questions coming in. So if we have another pandemic situation, how can polarization be avoided by right policies in place? In other words, what lessons learned from COVID to avoid this situation? So, I mean, I do think that to an extent, we have to take every disease risk at, we have to look at the actual epidemiology of it, and I don't think there is one, this is one thing that bothers me about people talking about pandemic preparedness. There's an extent to which we can be prepared. What specifically we might do for any given disease, I think will vary and should vary based on the epidemiology of the disease itself and like how it is spread, so for instance, with monkeypox right now, I mean, there's still a lot we don't know. It seems to be not sort of spreading in a generalized way. So I do think it's probably appropriate to kind of target our response to those who are currently most at risk. Now, our response might have to change if the epidemiology of the disease changes. But I think what bothered me about COVID was that we sort of, and this is where I think the polarization happened on both sides, both in conservative and more liberal sides, that like, I think we went overboard in certain areas out of like panic and over concern. So for instance, I was not supportive of the school closures. Like I really thought that was going to be horribly damaging to children and, to our future and, everything. And I thought that was an overreaction. So I think in any given disease, you have to look at how it's transmitted, what the risks are, and what the risks of the policies that you might implement are as well, and try to balance out, those risks as much as you possibly can. It's not easy, but anyway, that would be sort of my thoughts. But also I would, again, really emphasize thinking more about how to deal with the economic catastrophes that occur when there are these outbreaks. And if we do need to reduce our social interactions, I think we're more prepared for that now than we were, but I think we still haven't thought about it quite enough. And then I see a question about how do you hope your work will allow us to meet on the middle and come back to solution-oriented discussion? I mean, that's a bit harder, but I do think that the main people I honestly want to influence are people in public health, because I just see that people in public health are very myopic in their visions of things. Like when they see that, okay, we have a disease risk, right? We have COVID-19. We need to do everything we can to reduce COVID-19 transmission. But they're not thinking about, well, what are all the other knock-on effects of these policies that we're implementing, right? So, and that not every policy has the same side effects as other policies, right? So like, for instance, social distancing and lockdown measures, tons of side effects, obviously, like, and not just in terms of the economy, in terms of health, in terms of public health. So I was against the lockdown measures because of public health, because I was concerned about what is this going to do in terms of social isolation, suicide, overdose, domestic violence, child abuse, all of these things that might and the economic effects, which also have health effects, versus, for instance, asking people to wear a mask. There's very few side effects of asking people to wear a mask other than, I mean, there are some, but, they're much more mild than like, let's blow up the entire economy, right? So I think part of getting back to a solution-oriented discussion is acknowledging that not all policies are equal. Not all policies have equal effects, and some policies burden certain groups more than others. And asking this question, going back to the value debates, who should be burdened, right? Who is it appropriate to burden? So I thought the school closures overly burdened children, working parents, in ways that we should have tried to reduce. We should have tried to mitigate. Whereas like reopening businesses, that burdens small business owners, yes, but there were ways that we could have economically offset them that still could have, evened things out a bit. So anyway, that's sort of my thinking there. Then I see another question from Avery. So I believe the discrepancy of experts and politicians helped fuel the fire. For example, experts and government officials were saying one thing, but after BLM riots, those same experts were justifying those people's actions when they originally opposed it. It's okay to go to a protest with tens of thousands of people. Yeah, so I mean, I agree that it was very interesting, the response to the protests. So when it came to the protests, there really wasn't much debate, actually. I mean, I think it was right to allow the protests. Let me just say that, up front, because again, like I am always very concerned at the way that public health can be abused towards authoritarian ends, right? And so I don't think that we should just conclude that because there's a health risk that it means that we need to shut down everything, right? Like we need to really be critical about like, when is it appropriate to shut down, who should be burdened, et cetera. But I will say from a public health perspective, the protests were largely outside, right? Yes, people were probably huddled together too closely, but people could wear masks. I don't think the risks from the protest, and in that case, I think allowing the protests was clearly better than not allowing the protests. So, even from a public health standpoint, I would have said that, you should do allow public health, the BLM protests, or you should not try to shut it down on public health grounds. But I think there was a little bit of hypocrisy there, yes, in some respects.